Welcome to South Georgia Career Center's Medical Assistant class. Chapter 1, The Medical Assistant. Contents in this chapter are: History of Medicine Timeline, Laws and Ethics, Patient Care, Medication Administration, and Administrative Duties. History of Medicine Timeline. 2600 BC, Imhotep, Egyptian, describes the diagnosis and treatment of 200 diseases. 500 BC, Alcmaeon of Croton characterized the difference of veins from arteries. 460 BC, Hippocrates was born, also known as the father of medicine, starts the scientific study of medicine and prescribes aspirin-like medicine. 300 BC, Diocles has written the first known anatomy book. 280 BC, Herophilus began the study of the nervous system. 130 AD, Galen was born, a Greek physician to Roman emperors and gladiators. 60 AD, De Materia Medica was written by Pedanius Dioscorides, between 30 to 90 AD. 910, Rhazes identifies smallpox. 1010, the Book of Healing and the Canon of Medicine are written by Avicii. 1249, spectacles are invented by Roger Bacon. 1489, dissection of corpses by Leonardo da Vinci. 1543, findings on human anatomy are published in De Fabrica Corporis Humani by Verslius. 1590, invention of the microscope by Zacharias Janssen. 1628, an anatomical study of the motion of the heart and of the blood in animals is published by William Harvey and is the basis for future research on blood vessels, arteries, and the heart. 1656, experiments with canine blood transfusions take place by Sir Christopher Wren. 1670, discovery of blood cells by Anton van Leeuwenhoek. 1683, observation of bacteria by Anton van Leeuwenhoek. 1701, first smallpox inoculations given by Giacomo Polrini. 1747, treatise of the scurvy published by James Lind, stating that citrus fruits prevent scurvy. 1763, the first successful appendectomy performed by Claudius Mand. 1796, process development of vaccination for smallpox by Edward Jenner. 1800, discovery of the anesthetic properties of nitrous oxide by Sir Humphrey Davy. 1816, invention of the stethoscope by René Laennec. 1818, the first successful transfusion of human blood was performed by James Blundell. 1842, ether is used as a general anesthetic by Crawford W. Long. 1844, nitrous oxide is used as an anesthetic by Dr. Horace Wells. 1846, dentist William Morton is the first to publish the process of using anesthetic properties of nitrous oxide. 1847, discovery of how to prevent transmission of puerperal fever by Ignaz Semmelweis. 1849, first woman to gain a medical degree from Geneva Medical College in NY was Elizabeth Blackwell. 1853, development of the syringe by Charles Gabriel Pravats and Alexander Wood. 1857, germs are identified as cause of disease by Louis Pasteur. 1867, Joseph Lister publishes Antiseptic Principle of the Practice of Surgery as he develops the use of antiseptic surgical methods. 1870, Louis Pasteur and Robert Koch established the germ theory of disease. 1879, development of the first cholera vaccine. 1881, Louis Pasteur develops the first anthrax vaccine. 1882, Louis Pasteur develops the first rabies vaccine. Discovery of TB bacillus by Robert Koch. 1887, development of the first contact lenses. 1890, discovery of antitoxins and development of tetanus and diphtheria vaccines by Ivan Behring. 1895, discovery of X-rays by Wilhelm Conrad Röntgen. 1896, the development of the first vaccine for typhoid fever. 1897, development of the first vaccine for bubonic plague. 1899, development of aspirin by Felix Hoffmann. 1901, introduction of the system to classify blood types by Karl Landsteiner. 1913, Dr. Paul Dudley White explores the use of the ECG, electrocardiograph. 1921, discovery that lack of vitamin D causes rickets by Edward Mellanby. The invention of Band-Aid by Earl Dixon. 1926, development of the first vaccine for whooping cough. 1927, development of the first vaccine for tuberculosis. 1928, discovery of penicillin by Sir Alexander Fleming. 1935, development of the first vaccine for yellow fever. 1937, the development of the first vaccine for typhus. 1943, discovery of the antibiotic streptomycin by Selman A. Waxman. 1945, development of the first vaccine for influenza. 1950, invention of the first cardiac pacemaker by John Hopps. 1952, development of the first vaccine for polio by Jonas Salk. 1953, Francis Crick and James Watson work on the structure of the DNA molecule. 1954, the first kidney transplant performed by Dr. Joseph E. Murray. 1963, invention of the balloon embolectomy catheter by Thomas Fogarty. 1964, the development of the first vaccine for measles. 1967, the first human heart transplant performed by Dr. Christiaan Barnard. Development of the first vaccine for mumps. 1970, development of the first vaccine for rubella. 1974, development of the first vaccine for chickenpox. 1975, invention of CAT scans by Robert S. Ledley. 1977, development of the first vaccine for pneumonia. 1978, birth of the first test tube baby. Development of the first vaccine for meningitis. 1980, smallpox is eradicated. 1981, development of the first vaccine for hepatitis B. 1983, identification of HIV. 1984, the first genetic fingerprinting method is devised by Alex Jeffreys. 1985, invention of the artificial kidney dialysis machine by Willem J. Kolff. 1992, development of the first vaccine for hepatitis A. 1996, the first clone is Dolly the sheep. 2006, development of a vaccine to target a cause of cancer, laws and ethics. Medical assistant is the term for healthcare providers that perform medical as well as administrative tasks to support other health professionals, such as doctors. The physician may decide on the amount of appropriate aid from the medical assistant, such as directly supervised incisions, aspiration of hypodermic fat, administering local anesthesia, all of which are not considered to be duties of medical assistants. Routine tasks for the medical assistant may include taking a patient's vital signs, recording information in the form of medical record keeping, administering medications, preparation of medical supplies, sterilization, destruction of all living microorganisms by chemical disinfectants or boiling for 20 minutes, as in dishes, of medical equipment or supplies, such as dishes from patients with communicable/contagious diseases, as well as collection and preparation of fluids and tissue for testing. Administrative duties for the medical assistant may include greeting patients, medical record keeping, answering telephones, filing insurance forms, scheduling appointments, and/or arranging admission for hospitals or laboratory and billing. Medical assistants work under the direct supervision of a physician. They perform clinical duties which are authorized by the physician, although if the situation warrants it, the medical assistant is allowed to give emergency care in the absence of the physician. If patients have more serious conditions, such as stroke, heart attack, hemorrhage, or shock, the medical assistant should call for an ambulance if no doctors or nurses are present. Medical assistants may also instruct patients about medications, administer medications, call in prescriptions to pharmacies, and/or authorize medication refills. Some medications are dangerous or habit-forming and require a prescription in order for a patient to obtain these medications. The medical assistant should have basic knowledge of the laws and ethics as they apply to the medical field. As medical assistants work with the public, they should always follow a good manner by being neat and well-groomed, as well as following a good taste in the wardrobe when not wearing a uniform, as this can have a positive psychological effect on the patient. A medical assistant must be able to put patients at ease and explain medical instructions and/or procedures. Although when interacting with patients, a medical assistant should not discuss a patient's complaint with them or give a prognosis. Prognosis is the opinion to the probable cause and outcome of a disease, as patients tend to take the medical assistant's opinions as those of the physician. Being neat also applies to the administrative field, as well as being organized, especially if the administrative working place is in view for patients and free of clutter. Patient care. Patient care is very important for the medical assistant. Interacting with patients, making them feel at ease and comfortable, taking vital signs or administering medications, as well as explaining medical procedures are all part of patient care. Workplace and patient surroundings should always be sanitized, as bacteria flourishes in hot and damp areas and can cause health problems. Communication with patients is a large portion of a medical assistant's job, as the medical assistant will listen to patients' concerns, answer questions, and instruct medical procedures or medications. The medical assistant should always be friendly, well-spoken, and well-mannered. When working in a medical office setting, the medical assistant should always try to make patients feel comfortable. Any procedures performed, such as taking vital signs, administration of medication, or others, should be well explained to the patient. When working in clinical settings, the medical assistant should as well always explain any procedures and be able to listen to any concerns a patient might have, caring for bedridden or bed-stricken patients. In clinical settings where the patients are required to stay in bed, bedridden or bed-stricken, the medical assistant can make patients feel more comfortable by doing a variety of things, depending on the discomfort, including general support should be provided for the back and joints, in order to prevent strain. Arms and legs should be in a comfortable position and, if needed, supported. During bed changes, communication with the patient is important to gain cooperation. Movement should be guided rather than lifting patients. Other considerations: offering pillows for support, such as when the patient is uncomfortable lying on the side. Bed cradle, to keep the weight of upper beds off patients. Air rings under buttocks, if signs of a pressure sore at the base of the spine show. Medication administration. Administering medication involves providing patients with medications prescribed and intended for the diagnosis, treatment, or prevention of medical conditions. Laws regarding the administration of medication can vary from state to state. Generally, physicians, doctors, nurse practitioners, nurses, and physician assistants are trained and authorized to administer medications. Certain medications are restricted by state and federal laws in their distribution and access to them, as they are controlled substances and can be abused. Responsible measures should be taken with these controlled substances, such as accountability for discarded substances, counting of medical supply at regular intervals, as well as locked storage for these substances. Prescriptions. In order for patients to obtain certain medications, as they are habit-forming, prescriptions are written. Prescriptions should contain the patient name, date, and time it was written, as well as the signature of the physician or doctor ordering the prescription. Topical administration. Onto the skin, epicutaneous. Inhalational. Onto the conjunctiva, eye drops. eardrops. Through mucous membranes in the body. Enteral administration. By swallowing, oral route. Through the inner cheek or gum, buccal route. Under the tongue, sublingual route. Through feeding tube. Through the anus. Parenteral administration. Into veins, intravenous. Into arteries, intraarterial. Into bone marrow, intraosseous infusion. Into muscles, intramuscular. Into the skin, intradermal. Administering medication by injection beneath the skin is called subcutaneous administration. Common types of medication. Analgesics. Medications are used to alleviate pain. Two main types: non-narcotic for mild pain, narcotic analgesics for severe pain. Common medications: codeine, Vicodin, hydrocodone, oxycontin, naproxen. Darvon, aspirin, Tylenol, morphine, cocaine, and methadone. Anti-anxiety drugs. Medications to suppress anxiety and relax muscles. Common medications: Zoloft, Lexapro, and Effexor. Antiarrhythmics. Medications to control irregular heartbeat. Common medications: beta blockers, acebutolol, betaxolol, ismolol, nadolol, sodium channel blockers, disopyramide, mexiltine, flecainide, propafenone, potassium channel blockers, amiodarone, bipridil, ibutylide, tetisimol, and calcium channel blockers, diltiazem, verapamil. Antibiotics. Medications used to infection caused by bacteria, such as diphtheria. Antibiotics stop the infection-producing organisms. Certain medications need to be refrigerated, such as amoxicillin or aureomycin. Common medications: penicillins, cephalosporins, macrolides, sulfonamides. Antidepressants. Medications used to treat depression. Three main groups of antidepressants: tricyclic antidepressants, benzodiazepines, and serotonin-boosting medications. Tricyclic antidepressants: Elavil, Flexeril, Pamlar, Sinequin, Dizeril. Benzodiazepines: Xanax and Klonopin. Serotonin-boosting drugs: Prozac, Paxil, Effexor, Surzone, Zoloft. Antifungals. Medications used to treat infections caused by a fungus, such as ringworm. Divided into systemic, taken by mouth or injection, and topical, applied to the skin. Systemic drugs: Nizoral, Diflucan, Spiranex, Monistat. Topical drugs: Ciclopirox, Iconazole, Nystatin, Turconazole. Antihistamines. Medications used to treat effects of allergic reactions. Common medications: Benadryl, Atarax, Hismanal, Chlortripalon, Claritin. Antihypertensive. Medications used to lower blood pressure. Common medications: diuretics, beta blockers, ACE inhibitors. Anti-inflammatories. Medications used to reduce inflammation. Divided into steroids and non-steroidal anti-inflammatory drugs, NSAIDs. Steroids, referred to as corticosteroids, reduce inflammation or swelling. NSAIDs alleviate pain by counteracting the COX enzyme. Common steroids: corticosterone, cortisone, aldosterone. Common NSAIDs: aspirin, ibuprofen, naproxen, Celebrex, antipsychotics. Medications used to treat psychiatric disorders. Common medications: butyrophenones, phenothiazines, thiaxantins. Antivirals. Medications used to treat viral infections. Most antiviral nowadays are used to treat HIV. Common medications: Atripla, Darunavir, Nevirapine, Truvada. Beta blockers. Medications used to reduce oxygen needs of the heart. Common medications: betaxolol, ismolol, cardiolol, penbatolol, labetalol. Cold remedies. Medications to treat common colds. Common medications: aspirin, acetaminophen, decongestants, cough suppressants. Medications used to relieve cough. Medications may contain honey, menthol and soothe throat irritation. Decongestants. Medications used to reduce swelling of the mucous membranes. Commonly used to relieve nasal stuffiness. Diuretics. Medications used to increase the quantity of urine produced by the kidneys. Common medications: aldactazide, diazide, Maxeta, Modretic. Hormones. Medications used to restore hormone deficiency, as in diabetes mellitus, where too little of a certain hormone is produced. Medication restore this deficiency. Hypoglycemic. Medications used to lower the level of glucose in the blood. Common medications: thiazolidinedione, Iganid, sulfonylurea. Immunosuppressives. Medications used to treat autoimmune diseases. Common medications: methotrexate, azathioprine, alkylating agents. Laxatives. Medications used to increase the frequency and ease bowel movements. Common medications: inulose, psyllium, consul, colis, colite. Sleeping aids. Medications used to help with sleeping disorders. Common medications: benzodiazepines, barbiturates, Ambien, anesthetics. These medications cause the reversible loss of sensation, also called anesthesia. Categorized into local and general anesthetics. Local anesthetics include Procaine, Amethicane, Prilocaine, Ropivacaine, Novocaine, Dobucaine, Mepivacaine, Bupivacaine, Trimecaine, Propixicane, Chloroprocaine, cocaine. General anesthetics include inhaled, enflurane, halothane, sevoflurane, isoflurane, and intravenous, barbiturates, etomidate, ketamine, benzodiazepines, propofol. Administrative duties. The duties of the medical assistant can be different depending on the workplace, but common administrative duties may include the keeping, filing, and updating of medical records of patients, such as vital statistics that include data relating to births, deaths, and marriages. When obtaining medical record information, patients should be discouraged to give irrelevant, inappropriate information. Record medical history of patients, as well as test, result in individual record sheets. Record bills for insurance purposes. Complete medical insurance forms. Scheduling appointments for patients. Appointments should be scheduled after patient needs. Contact other medical departments such as the laboratory to schedule tests. Common office functions like filing and answering phones. Methods of filing. By subject, filed primarily by the main subject. By numbers, numerical order. By letters, alphabetical order. By date, chronological order. By places, geographical order. Medical insurance, managed care systems. HMO. Patients pay fixed amounts, periodic fees, for medical care from providers belonging to HMO. Offer more cost advantages when compared with traditional payment plans. Tend to offer more coverage like medical screenings and routine physical checkups. Generally offer lower hospitalization rates. PPO. Contractual arrangements which provide services at discount to volume group of patients. PPO providers work on a fee-for-service basis, similar to traditional payment plans. Allow the use of primary care providers outside the network. HMO does not.